I'm Dr. Troy Spurl, and our podcast is Synapse SNPs. Our podcast teaches people about how the body is supposed to work, basically how we were innately made. Have you ever wondered why you get headaches? Ever wondered why you wake up and your feet don't work in the morning and they're achy, and then as you get walking, it gets better? Have you ever wondered why you don't remember your dreams? Have you ever wondered why you're gaining weight even though you're eating right, you're exercising, and the weight keeps coming on? Have you ever wondered why you're just feeling depressed? It's hard to get up off the couch. If you ever wondered about why you feel these things and why you're not just feeling right, listen to our podcast to get the answers. We get to the root cause and we tell you why. Make sure you're listening to Synapse SNPs each and every week where we answer the questions that you guys have. Also, you can find us at officialsynapse.com. That's officialsynapse, synapse.com. Welcome to Synapse SNPs. This is Dr. Troy, and I'm joined today with Richelle, our infamous PA, who has been called a unicorn and many other good things when it comes to hormone health and just helping the team and people across the country. So thank you for joining us today. Yeah. We're lucky because we actually have her in the clinic here in Minnesota. So it's been a blessing to have you actually here this week. And
it's a lot of fun.
We've been busy. So yeah, I just popped my head in and I pretend to ask if you need something.
He asked me if I have a minute. I say for him I always have two.
Yes, but I don't really need anything.
Really have
so it's just nice to be able to pop in.
Yeah, so true.
So today we're going to talk about hormones and methylation.
Yeah.
So two interesting categories that actually blend together quite nicely. So I think I'll maybe start with a little bit on methylation, just the real basics, and then we'll talk specifically about the hormones. But methylation essentially works in four areas of our body. So we have liver detox, which is where hormones come into play. We have neurotransmitters in brain, and especially mental health. Hormones come into play there too. And then it's protectant for DNA, so DNA methylation. So it helps against prevention naturally as far as any oncogenic type things. And then the last thing is heart health. So we know that methylation and homocysteine go together. So high homocysteine levels that can lead to heart dysfunction, strokes, cardiovascular disease. So I am a huge fan of proper methylation.
Yeah.
Yeah. And a lot of people have heard the term MTHFR. That's all the rage right now. And people need to know that is just one small component of what methylation actually is. So there's a lot more to it. In fact, one of my favorite researchers, Dr. Walsh, he wrote the book Nutrient Power. He spent 30 years investigating methylation, and we have a 109-page protocol just on methylation.
Some light reading.
Light reading, yes, that's right. And so as you kind of go through the process of improving your methylation balance, there's all these nuances, and you have to kind of tweak things a little bit. Yeah. Because sometimes you start improving the methylation and your serotonin levels will go up, but then all of a sudden dopamine drops or you have trouble sleeping. So it's a really important topic. And I want to specifically talk just a little bit about methylation and as it relates to hormones.
I get a question a lot, Dr. Craig, from patients. What is methylation?
So I was just asked that this morning, actually.
Yeah. So
I'm going to go with the semi-technical definition, and then we're going to go into the, that makes more sense. So truthfully, if you remember in a science class, a methyl group is CH3. That's what methylation is. It's simply a methyl group. Yeah. And so if you think about what a methyl group does, it can actually completely change a molecule. So when you add a methyl group to an actual molecule, the most easiest way to say it is, if I have an inactive molecule and then I take a methyl group here, it's like a red flag going on there to tell the rest of the body you can now use it.
Sure.
So it activates it. So for example, in B12, you have cyanocobalamin, which is rarely used, and methylcobalamin becomes the methylated version of that, and now your body can use that B12.
Sure.
So you can have high levels of B12 circulating in your blood, but if you're not using it, it's useless.
That makes sense.
Yeah. So methylation is kind of like a red flag that then allows you to use it. True for serotonin and dopamine, it helps make the neurotransmitters. True for protection of the DNA, and then in the liver,
the methylation is one of the major components of the phase 2 detox pathway. And so you've got phase 1 and phase 2. One is sulfur and glutathione dependent. The other one is methylation.
So ladies,
dependent.
it's kind of like when you put on the necklace and it completes the outfit.
Yeah,
right?
that's
or
that's another way of saying
right.
it. Yes.
Or when you have two shoes that you're choosing between, and one will get you a little bit further, but one's going to hurt you if you walk in it. That's what we're talking about here. Yeah.
See, these are great. See, I learn stuff every time we do these podcasts. I learn things. Yes.
We know. The right necklace makes or breaks the outfit, and so it's kind of like
wait,
that.
I gotta write that down.
It just helps to put it into practical terms.
Yeah,
he
absolutely.
explains it so well.
Yeah. But now people get it.
The
necklace.
So when you go to pick out your closet, think this one helps me methylate, this one does not.
Yes, that's exactly
just
right.
how supplements work in that world too. Yeah.
So that is funny.
Mm-hmm. I was thinking of that as we were sitting here.
So I'm going to go through some of the methylation vitamins and the pathway itself. So I don't know, we'll get a nice image of this up here, but it's actually a nice circle of different chemicals, and it feeds into different other pathways. So you'll hear things like methionine, SAMe. SAMe is a natural antidepressant. When it's low, you can become depressed. When it's too high, you can almost become manic. And then certain things like heavy metals can disrupt these processes as well. And they're very much magnesium, B6 dependent. There's a lot of other nutrients.
Interesting.
There's also homocysteine we mentioned. And then there's an important B vitamin, folic acid. And the methylated version is, people have heard of the 5-methyl tetrahydrofolic reductase enzyme.
You did that well.
So, yeah. Try to get that out there.
Out there.
Yes. Mm-hmm. So zinc's also very important. So there's some key minerals that are really, really crucial. B6, zinc, folic acid, and B12, but you have to keep it into balance. Then it also, you can actually convert that in homocysteine to cystathionine and cysteine. And so those are very important for glutathione as well. So that's liver detox. Okay. So a lot of times people will have problems with methylation that then lead to other issues like can't tolerate my hormones anymore. So if they're recycling estrogen or they have estrogen intolerance, that can become an issue. Have you ever run into someone who has symptoms of estrogen dominance or estrogen, like too much estrogen, but they really don't have too much estrogen?
Right. Yeah. And
it
is a thing. And then when it comes to hormones specifically, which is a little off of what you're saying, but in the line of it, there's different ways of applying hormones to the body and feeding them to the body. So you can do different like topical creams versus a vaginal suppository, versus you've heard of pellets and things like that. They're absorbed by the body in different ways to sometimes circumnavigate these problems for you. So that's where it's a fun world because it's custom to who you are and the way you can process things. But it is very important to do the behind the scenes work first. Because then you're going to be more absorbent and more tolerant and we use lesser dosages because you'll be able to be functional with them.
Well, this is one of the reasons why I want to do this podcast because our team will work on the methylation transsulfuration pathways, which takes time. And like we said, there's course correction, but many of these people are struggling. So if you kind of feel like you're losing your mind, you're not yourself, or it's been years since you've had that grounded foundation, you can get on the hormones.
Right.
Being delivered, bypassing the liver, so that you actually get some stability while we work on the root cause.
Right. Yeah.
So many women and men too. There are men that go through this as well. That just knowing that the root cause is being worked on, and they don't necessarily have to be on hormones the entirety of their life, gives them peace of mind as well.
Yeah, and it is neat. It's a neat world to meld because they are so intertwined. And you're getting two different perspectives, but we're complementing each other's work, and we're always co-collaborating. Which is so irregular out there.
Yes, I was just about to say that.
You don't often get 3 clinicians for the price of 1.
Yes.
And you don't often get, honestly, biochemical minds translating into clinical and relevant application to you as the patient. You, in traditional medicine, get dose and pill for symptom.
Right.
Here, you get root cause with a little bit of whatever's going to help you get through the hump. And then longevity of care. Is the way that it goes.
And for us, it's a blessing because we've not to be able to work with someone who's going to help with the actual hormone, but not dismiss the root cause work that
Absolutely
we're
not.
doing is completely, it's a blessing, because
Yeah.
we've run into that a lot
Yeah,
too.
sure.
Because sometimes doctors, when they don't understand the process, they'll say, "Oh, no, stop that. You just need this." And so,
Right.
so it's really nice to actually blend the two worlds
Mm-hmm.
together. And there are times when they work really well, and this
Yeah.
is like an orchestra, and it's like beautiful music.
So
And then
true.
there's times it's like a screeching new violin kind of
clunky.
player, a little
Yeah.
clunky. So
True.
so this has been great. So when it comes to some of the symptoms that you see with people with the hormone side of things, what does someone with hormone and methylation issues look like?
Yeah, I think one of the most common things is I'm not sleeping well.
Yeah.
Or I should have all the energy in the world, but I'm tired. Brain fog lumps into that too, where I can't quite find my words, but I know that I have my thoughts up here.
Yes.
I would say on the female side, things like a low libido is possible. Actually, on the male side too.
Male side too,
Absolutely.
yeah.
I'm sorry. Yeah, I can speak for both there. Things just like I don't feel like I'm in my own. It's a dance term, but I'm in the pocket. I'm in my own groove anymore. You know, I knew myself to be one way, and I'm just living subsurface of my potential and my maximum, optimum expression of myself in that way. I get that a lot from people.
Yeah, I've had one person said, I feel like I'm here, but I'm
Right.
seeing myself over
Exactly.
here. Like I'm
Yes.
like displaced from who I am.
Right.
It's
Yeah.
not
It's this alternative view of yourself
Yeah,
that is a little
exactly.
discordant with who you know yourself to be routinely.
Yes.
When we talk about females, vaginal dryness is obviously a big condition, or you're more prone to recurrent yeast infections and cystitis than you once were before.
Yeah, that's
that
a
can be
big one.
problem.
Yeast infection, UTIs play a role with that, and same with the methylation issues.
Yep.
And we also see like some mood swings when it comes from anxiety and depression, and it
Very
can
true.
really wreak havoc with your sanity when you feel almost oppressed one day,
Right.
and then you swing into anxiousness.
Yeah.
And you're like, what is going on? And we do see this again with men and women because it's very, very important for the guys out there to know that it's not as much as the women, but there definitely are issues. Guys tend to trend towards the heart homocysteine problems more, but it does exist where they're going through these mood swings and these anxiety and depression. And I was explaining it to one of our patients, and I explained it like this. They were going through some pretty severe stuff, and it was almost like they're having a panic attack, and depression at the same time.
It's a hard world to be in.
It's a hard world to be in, and it can wreak havoc with your memory. So forgetfulness is another big one.
True.
Like you were saying with brain fog and things of that nature, and it can wreak havoc with just your overall well-being, your presence and how you see the world around you. And so many times, if you find yourself just crying for no reason or just a hard time getting up off the couch, that's one of the signs of this potential imbalance.
Yeah, that makes a lot of sense. I have found that pregnenolone is very helpful for people who are under chronic illness, stress, or trauma routinely. It's this upstream hormone. I call it like the grandparent of the family. And then there's the parent DHEA, and everything trickles down after that. Testosterone, estradiol, and progesterone, they're the kids. They get they're rowdy, they get all the noise in the media.
Yes.
But
They get all the attention.
They get all the attention, and rightfully so, you know. Plus they're expensive.
Yes.
Just kidding. My identicals are very inexpensive. I'm going to say that. But pregnenolone is one of the chief cornerstone hormones that actually, when you go to a LabCorp slip and you look at the reference range, it has no reference range because people don't check it very often.
Yeah.
And so I have found that that's been very beneficial for both male and female at starting that upflow stream of feeding the downstream sex hormones, because when you're under that chronic illness, trauma, or stress, it actually gets shunted into cortisol production and replenishment because you're typically in this fight and flight response routinely. And so it'll shunt it into that cortisol pathway and then deviate from your sex hormones creation. So you feel dry in the sex hormone category, you're stealing it into your cortisol, and it's not enough to keep up. And so that's one that I really love putting on board, especially for males. For some reason, clinically, I just see it. It gives them that verbal fluency. It gives them that sharpness of thought. It preserves your color vision. And it just starts to light the flame again once more. And so for males, I love pregnenolone. For females, I love oxytocin. Totally different.
The love hormone for the females, oxytocin.
I mean, this is what I'm wearing.
Yeah, it's an oxytocin sweater.
Oxytocin sweater. So.
Yeah, this is not really a pregnenolone shirt, but it's
it's okay. Yeah, I love oxytocin. It's an off-purpose, pseudopeptide. It's really a hormone, truly, that we can use in a nasal spray form to help women feel more calm, well-rested, give them that sense of grace back to themselves.
Yeah.
So it depends on who you are, what you're going through, what your labs are saying, but
Yeah.
we have some very unique mixtures of things to complement your wealth of health. So.
I did an internship. It was a long time ago,
Yeah.
but it was back in the '90s, and the doctor I was interning with worked a lot with professional runners. Some of them were these long distance runners, like 3-day
Sure.
runs. You run
Oh, my
straight for
goodness.
3 days. Yeah, it was
Not me.
no, not me either. It was intense. And his secret weapon was pregnenolone.
Was it really?
He used pregnenolone, and
Yeah.
their joint pain went away. So
Really?
these long distance runners that didn't have the antioxidant capacity to manage the free radicals from the running would
Very
recover and
interesting.
do well on pregnenolone.
That's really fascinating.
Yeah.
Yeah.
It was great, and they all said the same thing. Like,
Yeah.
this is the one thing I wouldn't give up.
Wow. And
Yeah.
it's so inexpensive. We
It
can
is.
talk cost. It's very cheap. You can
Yeah.
get it over the counter or you can get it compounded pure.
Yeah.
Part of the reason you would work with a compounding pharmacy is so you don't have any fillers or fluffs that would, impede your processes
Yep.
and methylation and stuff like that. So that's a fun technique for us to use.
I have another fun fact.
Do you?
Yes.
I want to know all of them.
Okay, so here's one of my combination of methylation and
Yes.
hormones.
Mhm.
So not a lot of people know this, but hormones come from cholesterol. So
Right.
just like pregnenolone is
True.
upstream, cholesterol is really has got a
to
component to it. Yeah, it's right before pregnenolone.
Mm-hmm.
And cholesterol a lot of times will go up when you have methylation problems.
Okay.
So then people get put on cholesterol lowering medications,
Right.
which can potentially wreak havoc on their hormones.
Absolutely.
So we see this cascade of events where all of a sudden you're now depleted in methylation,
Right.
you're now getting depleted in hormones, and you've just you've lowered your cholesterol,
Right.
protected your heart a little bit, and now you've got lowered hormones and lowered methylation status.
Yeah.
And what happens? Mentally, you feel worse. There's instability.
Right.
So I'm also going to throw that out there with any cholesterol lowering guidance. Just be aware, and it's important too. We don't want stiff or stiff arteries. There are differently ways to help that.
Right.
But it's very important to know that there's a hormone connection too, especially
That's
for
true.
long term. In the acute situation, not as much, but long term for sure.
Yeah, and there's so many other ways to treat cholesterol-related
Yes.
problems. Actually, estradiol as a hormone is very powerful in regulating your lipids, and so why not work on that
Right.
instead of just giving your body, instead of stripping your body of a nutrient
Right.
of a foundational building block? Why not add to your body something that you already use and know how to use, rather than something synthetic like a statin that is pharmaceutically manipulated? You have no chemistry identifying with it, and you're
Right.
asking your body to do something about it. Why not use estradiol when you know how to use it? It's already in your body. When we talk about estradiol, we're talking about bioidentical estradiol.
Yep.
Same chemical structure as what is there, and it helps regulate your lipids better. It's fascinating information.
Yeah, and in functional medicine, we're always looking at the body, and a lot of times, we were not all of a sudden made to just to do things wrong. So when
Right.
cholesterol elevates, there's a reason for it.
Right.
So it's not because you have a deficiency in some medication or anything like that. There's something else in play there. So
Right.
looking at what is the root cause of that
Mm-hmm.
and addressing that is, in our world, much more proactively going after your health. And to your point, there are other things we can use to actually bring people back and have some stability while you're working on the root cause issues.
Absolutely.
Yeah.
And it's really helpful to work with practitioners like you and all the other chiropractors who are functionally trained in this way, because they know to look for that.
Yeah.
It's not me just going to my primary care and getting the yearly, CBC and thyroid labs that doesn't investigate the behind-the-scenes networking like pregnenolone, which we know they don't even have a reference range for because nobody checks it.
That's right.
We check it.
Yes.
Maybe we will be the reference range.
Yeah,
one day.
we'll be setting the reference. Well, we have a lot of data. We're
so true.
we're spreadsheet
Yeah.
people here, so especially
We
we have
much
Dr.
are.
Josh, and
I know.
I love my spreadsheets. I have now. Dr. Josh goes to sleep dreaming of spreadsheets, but
I think he has a shirt that says something about
he
that,
does.
actually.
Yes,
Yeah.
absolutely.
Uh-huh.
But we've definitely tracking that data.
Yeah. What is it like, Dr. Troy? Because I get the question so much, well, what is methylation? And then I get the question, well, how do I know if I'm methylating properly? Like,
That's a great question.
What maybe clinically, but I was thinking more like what test-wise should I go and do about that to find out?
Yeah, so there's a methylation panel that we can run. We do it through Genova Diagnostics and Doctors Data. They've got great methylation panels. You can get it in our standard blood panel, homocysteine, if that markers off as a potential sign of methylation issues. You can have undermethylation and overmethylation.
Oh, that's interesting.
So they cause a lot of psychiatric disorders and a lot of detox and or cancer disorders. Things of that nature.
On both ends of the spectrum?
On both ends of the spectrum.
So they seem the same, but one is under and one is upward.
We actually have a list of character traits for people who are overmethylated versus undermethylated. And it gets really specific.
Yeah.
Like fear of flying.
Oh, really?
Is a sign of one of the...
That's me.
Yeah, is it?
Yeah.
Overmethylation.
Yeah.
So that might be in play.
I'm going to get my blood checked.
Yes, right. Also, other things like genetic schizophrenic disorders, not necessarily true schizophrenia, but other schizophrenic disorders, or bipolar is another one where we start to see the highs and lows. And so depression, classic undermethylation.
Yeah.
So there are some great personality types. One of the other ones for overmethylation is early achievement, or really overachievement in school in the early years. And so there's a lot of unique things that occur in the brain. And it's because you're concentrating certain neurotransmitters too well. And it's just like you may have heard of serotonin sickness. Serotonin is a good thing. It can make you feel happy. But if you have too much of it, it actually is catastrophically detrimental. You start hallucinating, and there's all kinds of things. Same with excess dopamine. Right now, in these days, everyone's like depleting their dopamine, playing video games and stuff. But you can actually have hysteria with excess dopamine.
Interesting.
And so there's a line in a song that I always remember. I'm the type of guy who laughs at a funeral.
Oh.
And that's what the excess dopamine person does.
Yeah.
They go to cry because they're at a funeral, and it comes out as laughter because they have too much dopamine, which is the joy, happy neurotransmitter. So the brain confuses crying, and you end up laughing. And so it made into a song lyric. They had no idea. I could tell you, whoever wrote that song has methylation issues. Yes.
Didn't know it.
Didn't know it. They probably, I hope they do now.
Right.
Yes.
Times have changed.
Yeah. But it's a great question.
So we start with blood work for that. Is that mainly
blood work? Well, personality. If you come in, we actually have a nice personality assessment.
Okay.
One of my standard ways to identify if someone has low methylation status is I tell dad jokes, and if they don't laugh, then I know there's a problem. If you don't laugh at my jokes, I know it's something serious. Yes, it's really serious.
Yeah.
But personality, you can actually, as you're sitting across the desk from them, you can actually start to get a sense of it right away. And that's something, copper and zinc profiles also play into this, but I, a lot of times, will look at copper, zinc, and methylation status personality types as I'm asking them questions. Or even if I'm doing the exam, I'm engaged in assessing their muscle tone and how they respond to questions. Are they in their head, and different things, how they actually are behaving. You can glean a lot of information than lab work.
Yeah. And that's and this isn't independent to you. This is all the chiropractors that work with us here. They know how to do this all around the clock.
All around the clock. Yeah. They have the same 108-page protocol, and so they have to read it.
Right.
And do something with it.
Sure.
Yeah. And so, which they do. They're very good. And actually, Dr. Josh, who does the primary research here, he knows by far the most on methylation. He's got all the pathways memorized. I don't know how.
Some people do.
Some people do. That's his thing. Yeah, he loves it.
Yeah. So you get your blood work. How long can you expect to see, like, to go on to therapy and do, either supplements or medications, and then see changes in your behaviors or the outcomes personally? Are some of these long roads, or some of these quick fixes?
It depends on where you are. So, for example, with overmethylation, almost always there's an increased flare-up in symptoms for 2 to 3 weeks, and then a gradual decline.
Which is really important to know.
It really is. It
gets better before. If I got worse, I'd be like, "You're not doing anything right for me."
Yeah, right. So, and that's again from 30 years of research.
Right.
In undermethylation, a lot of times they feel a good beneficial change within the first 2 weeks, and then it just builds from there. So it tends to be much faster, but then they get stuck at the next part of the cycle, and some other weird symptom will pop up, and that's when you have to course correct.
Okay.
So a lot of times it's not just take this B vitamin and you'll be good the rest of your life. A lot of times you have to start with the B vitamin. 3 months down the road, all of a sudden I got headaches. Well, that's the typical sign that choline is now needed to help the liver methylate within the liver system.
Sure.
And so we'll look at things like milk thistle and other stuff to help liberate the liver detox part of it, because that's where the new sticking point is.
Okay. Yeah, so it's definitely a process.
Definitely a process. You do have to be hyper observant and report back, and don't dismiss little weird findings that are really consistent. So you'll notice a change. You're like, well, I do feel better here, but now I'm not sleeping, or I do feel better mentally, but I'm not. I've got these headaches now.
Yeah.
That's actually a great sign.
Interesting.
And those of us who really dive into methylation love to hear that. And so a lot of times patients will be like, why are you grinning? I just told you I'm suffering more. I'm like, no, but I know why. So, sorry.
It's not my dopamine excess.
Yeah, it's my dopamine excess. I'm the kind of guy that laughs at a funeral.
Right. Well, it's really good to hear, because I think we just assume that a bad symptom means something's wrong.
Yeah.
And sometimes that's not true. Sometimes it's actually that you're progressing in the right way, but you're just the next step ahead. And that there can be plateau phases, but we can, with someone like you, know exactly how to direct you to the next.
Yep, absolutely. And one of the challenges as a doctor, and you know this too, is when someone does have a side effect or another symptom, discerning, is it a true side effect?
True.
Or is this a good beneficial part of the process?
Right.
And that can be very challenging. And research, luckily, is kind of paying attention to those things now. So we're seeing more data that actually tells us, and more patient experience that tells us about, no, this is a good bad feeling.
Yeah,
instead of a bad feeling.
Sure. And it's so fascinating because the human body is so intelligent.
Yes.
You really do need to own the clues that it's giving you. When I tell people when they go on hormone therapy for the first time, especially if you've been postmenopausal for a while, or let's say andropausal on the male side, you downregulate your receptors, which means if you had a dining room table set for 10, you now have a dining room table set for 5.
Yeah.
And you have to do the homework behind the scenes of building up more receptors and putting back chairs so that you can host and harvest a 10-seat party once again.
Yeah.
So those first few months of that background homework are the greatest risks of actually having some excess side effects, because you have all this hormone we're giving to you. Hopefully I don't overdose you. We're giving you all this hormone, and you don't yet have all the chairs for the members to play along.
Right.
So you're doing this background info and methylating properly, building the receptors availability, and then eventually you get into this sweet song and dance about a year out after starting the hormone therapy, but there is a work of process associated with it.
Yes.
And so it's a very interesting, the two are very parallel in the way that they behave.
Absolutely, yeah. I've got a question for you.
Yes, sir.
So I have patients, I've seen a lot of patients, and they, these women have had surgeries where they have, they enter into menopause early because of removal of their ovaries and uterus, and many times they have methylation issues, because that's what set up the need in the beginning.
Yeah.
But can you speak to just what you do and some of the things you've seen, and how you help with women who've entered early menopause because of that?
Yeah, so it's interesting. If you still have your some people who have surgical issues and they take the uterus, they don't take the ovaries, and so that's helpful.
Yeah.
I typically see with women like that you don't go into menopause as early because you're still functionally utilizing the ovaries. But for women who have both, you do tend to go into early menopause if you have both removed. There's a hormone in your brain made by your pituitary gland called your FSH that can clue us into, because for women, how we know we go into menopause is usually the absence of menstruation or the funkiness of it, and then the absence of it, right? If you don't have a uterus, how do you know where you are?
Yeah.
So there's something called FSH, which is made by your pituitary gland, and it will evolve upwards into a higher number. Typically 50 or greater means that the shutdown has occurred of the normal cyclical process in a female body. And so we can track and trend that to see status quo as to well, am I menopausal, perimenopausal, or am I still kind of ovulating here and there if I have my ovaries, right? So that's one thing we can do. But in terms of symptoms, it's fair to acknowledge that you are likely going to experience things that you did not before, like the vaginal dryness, like a lack of firmness to your skin and collagen and texture, like poor sleep, things of that nature. And we can assist with, progesterone, testosterone if it's applicable, to help you through the transition as we're monitoring in the background that evolution for you.
Yeah.
So is that kind of what you were hitting on?
Oh,
a little
absolutely.
bit? Yeah.
I think there's a lot of women out there, and we're seeing hysterectomies, full and partial. We're seeing a lot more of that.
Yeah.
And so it's trending that way. And it's a personal theory, but methylation, environmental and personal triggers are part of this.
Right.
And so you can have the genetic predisposition for it, but never have any problems with it. But then you get exposed to something in the environment or a life stressor, and it can trigger these mechanisms and require methylation support. And if you don't get that, then we start to see problems with how you manage hormones, how you manage detoxification. So a lot of women are actually needing this methylation hormone support, and the ones that we've identified a lot are the ones that are getting the removal of the organ. So
which is, in some cases appropriate for certain things, but is oftentimes a little extreme.
Yeah.
But if it is you, there's definitely hope.
We can definitely, if we catch it soon enough, we can prevent it in certain circumstances. If there's an underlying methylation thing, if there's not, then then let you know that too.
Stay tuned.
Stay tuned. But it's just so common these days, and so we're seeing a lot of that.
Yeah, I will say there has been this bioidentical hormone replacement therapy world used to be a little bit more 50s, 60s onwards world. Yeah. And I'm seeing women in their 30s, that need full replacement. Yeah. Not very classically, but definitely more than before. Yeah. And there's a lot in the water, like you said, in the background that comes from environmental toxicity, from chemical toxicities, from pharmaceutical product toxicities and things of that nature. They're influencing those reproductive organs in an unhealthy way. Yeah. So if you come here, we try and catch that before. We try and clean that up for you. Yeah,
the earlier the better. It really is. Being proactive is so beneficial to prevent a lot of the things that a lot of women have gone through. So we prefer to catch things really early on, but that's not always the case.
No, but it is what we have to offer because we don't have her here today, but Dr. Ellie. She works with premenopausal females largely as her broad base, and she can do a lot of hormone rebalancing type programs for women. She's a specialist in PCOS, and she does the pelvic floor therapy, which is just phenomenal across all age groups, wherever you are in your reproductive journey. Yeah. And so we can get you, who does the methylation as the biochemistry master behind the scenes. We get Dr. Ellie, who deals with very needed population group of clients that often just kind of get passed over by the OBGYN and say, oh, it's just the decade, deal with it. Periods are painful. Side note, they're not. They're not supposed to be.
Not supposed to be.
They can be, but they're not supposed to be. And then you get someone like myself who can come along and assist in the therapies of symptoms and truly treatment at later cycles of the game. Yeah. So,
no, it really is. It's nice to having the complement of the entire group because we've got a lot of... I think maybe we should just one of these days, if there wasn't HIPAA compliance, I think we should have a camera in our meetings in the mornings.
I know, that would be fun, actually.
Yeah, because, speak a little bit about just what your experience is, because I know your name. The mornings you're there, your name comes up all the time. Yeah. Is Richelle there? So she's online a lot of times. Is Richelle there? Because they always have questions for hormone stuff.
Right. For people that know, I live out of state, and so that's why I travel back and forth between the two. But when we're there, so red flag meetings is what we call it. Can I say that? Am I releasing any secrets here? Red flag meeting. I actually don't know the name or the reason behind red flag.
Because when I first started them, there were so many red flags. There were so many fires we had to put out.
Got it. I assume that's what it meant, but I wasn't sure.
Yeah, and now it's like, now I get to tell 2 to 3 dad jokes during the time, and we get to talk about cases, and everyone's putting their input in there. Whereas when we first started, boy, it was just...
There was a lot going on.
There was a lot going on.
Yeah.
And,
So basically, we have every morning for almost an hour before everybody disperses and sees their patients and their cases uniquely. We actually have a think tank session together, which I so appreciate because medicine often doesn't talk across their lines.
Yeah.
In each of our chiropractors, Dr. Ellie, Dr. Josh, and then people like myself, the physician assistant on the team, Tammy, who's a nurse practitioner,
Yeah.
who's doing regenerative techniques in medicine. We all know what we know
Yeah.
uniquely and specially, and we've been trained in that so that we can be at the height of our excellence for our patients.
Yeah.
But we don't necessarily always have time to go learn the methylation. Look at this.
Yeah.
Can I show you this, people? This does not exist up here unless I have it maybe in front of me all the time. But Dr. Josh, he's got it up there. So Dr. Josh
instantly.
can sit here and he can just spit that out.
Yes.
Or you can come across and say one thing. So we come up with very unique solutions for difficult problems that cross the lines in a beautiful way of blending.
Yeah.
It's not crossed in a way of antagonistic, it's in synergy. And so, for example, like if we have people, I didn't know this, but like testosterone injections, well, I do know this now, but it stimulates the bone marrow to make more red blood cells. So if we have somebody that comes up and says, hey, I have this anemia that was difficult to manage, and maybe it's a male patient who's befitting of this, and I say, oh, hey, I know that testosterone does this. Well, we think in a collaborative way, could that be an appropriate fit for him? When we just ask the questions. And that's how medicine should be.
It is how it should be. I'm biased because I've been a part of it, but I've also been I've been privy to, now I've been doing Red Flag for 25 years. So I've been privy to really bad conversations and bad red flag meetings with people and team and really good ones. So we have a great team right now. This is the best that it's been because we have voices from different worlds, and we've had guest doctors stop in and be there, and interns, and we have one of our favorite surgeons who likes to come by, and we always like when he's in the room because he always says, "In our world,"
which is true,
which is very true. But it's really impactful to hear the different perspectives,
right?
And also a lot of the people that we have here that are more from the traditional medical model. Their mindset always goes to the worst case scenario almost every time.
If I stub my toe, I think it's coming off.
Yes, that's right. But it's just the way they're wired. Our nurses, the nurse practitioners, the MDs, and the PAs, but it's good because it allows us who think like we got like a knife sticking out of our leg, and we're like, no, it's
just clean it.
Just clean it. We're good. Bacteria. No, we need to. I'm going to go roll around in the dirt. So it's a nice blend.
It's a very nice blend
of being able to see it from all angles.
And what I think you had said earlier, and what's your adage that you say here, that we're excellence without ego? Excellence
without ego. Yes.
And I have found that to be very, very true.
Yeah.
Because sometimes the barrier to creative thought and like a learning process is that intimidation feeling of I don't want to look stupid.
Yes.
Where when we just I look stupid all the time at Red Flag.
Yes, and we want to actually.
Want to.
And I tell people that's my spiritual gift. And it's something that is a learned process because I studied really, really hard and did well in a lot of areas. And the more I learned, the more I knew how little I knew.
Right, and you have so many more questions.
And have way more questions, and so it becomes an investigation. And really, the secret is how you assess the information, gather the information, and then process it afterwards.
Yeah. Which is why we have, it's good for us to have foundations in place, like checking your methylation, like checking your hormones, because we're hitting a multifaceted point of view, and then we're able to bring those to the table, and everybody who has their appropriate respective training surrounding each of those areas can weigh in. And that's really, truly where I think new ideas are birthed.
Yeah, absolutely.
And that's what's so exciting about Synapse and why I love being a part of their family is because we really do think inside and outside of the box.
Yes.
Which is
we have so many ideas that we can't talk about.
True.
YouTube wouldn't let us actually say most of them, but we've got them on paper and we've got, we're just itching to get, we're actually rolling some of them out this year.
Yes.
But we're also behind the scenes doing a lot of work and experiments as far as just different processes before we bring it to market, of course, or bring it to the people.
Right.
But I love innovation. I love thinking outside the box. Yeah. But if you don't have the foundational need to assess this way, you don't really have anything to build off of. So you have to maintain that foundation and get good at it, get excellent at it. And then that allows you to look outside the box here at the other stuff. Yeah. And then you catch the the outliers, the
Right.
people who
Sure.
really,
They just
their
really
body
like that.
didn't read the textbook at all.
Cliff notes, maybe.
Yeah, cliff notes a little bit.
That's so true. That's why I love working in the hormone therapy world, which is my expertise, because there are certain forms of delivery of hormones, like I
Yeah.
alluded to. Like, for example, women with progesterone. If you take it in a pill form, it won't be utilized by the GI tract, and it'll be cleaved in the liver into a metabolite that goes and sits on the GABA receptor in your brain and produces a deep calm, a deep rest. And so the
GABA.
first side effect I usually hear from people,
Yeah.
Dr. Troy, is I'm sleeping again. And I
Yes.
say, great, it's
Yes.
working. But if you do progesterone as a cream, it doesn't give you that.
Yeah.
It'll give you some of the benefits, but it won't behave the same way. If you do progesterone as a vaginal suppository, again, it gives you a different, unique characteristic. The cream does not provide perfect endometrial protection if you still have your uterus, so it's important to know that.
Yeah.
You can use the cream for symptoms, but we're maybe not using it for the endometrial cavity. So getting to align with Synapse, who dedicates their time and attention to people who are specialized in modalities, it's very important because we can pull our tools individually based on what we know to deliver results for the exact specifications that you have for your own
This is
body.
also why Richelle gets called on a lot, because of these little gems that she
Yeah.
has, these nuances.
They're fun.
Yes.
They're fun. They
Yeah.
really are.
Well, and they're
fun.
game changers with
Mhm.
with outcomes, with helping
True.
people feel better.
Yeah,
So,
that's
yeah.
so true.
Yes.
Yeah. Well,
Well,
this
great.
has been great.
Yeah, this has
I
been really
enjoyed
good.
it. Mhm.
We will definitely do this again, and I'm looking forward.
Thank
I know
Yeah.
you and Dr. Ellie,
Yes.
and maybe one other practitioner here. I'm not sure who we're going to sneak in
Yeah.
there.
Guest artist.
Guest, yes. So we've got
Yeah.
many. We've got Dr. Ashley, Dr. Amber.
Absolutely.
We've got Ellie. We've got two Ellies
We
now.
have two Ellies, that's
Yes.
true.
So we'll see who's coming up next, but I know
Absolutely.
we've got on the docket here. So
Mhm.
thanks again for
Yeah.
joining us, and we
Thanks for letting me be
we
here.
pray this finds you well, and yeah, thank you for listening to us and being part of it. Yeah,
Yeah, you're a part of the family, and so we enjoy it all.
thank you very much.
Thanks, guys.
Thank you for listening to the Synapse SNPs podcast. If you like what you heard, subscribe to the podcast and share the podcast. To learn more, check out our website at www.officialsynapse.com. Until next time, this has been Synapse SNPs podcast. We'll see you on the next episode. This podcast is for information purposes only and should under no circumstances be considered medical advice or substitute for medical care. Any information given in this podcast is not intended to diagnose or treat any disease and is at the user's own risk. Please first consult a licensed healthcare professional.